All right, hip problems. We normally think about them being an older adult problem, but as many as 15% of newborn babies can be affected.
It can be genetic, but doctors say there is an increase in hip dysplasia in babies who are swaddled incorrectly. Bianca Castro reports.
When 6-week-old Tobin went to his first doctor's appointment, Mom Kelsey had one burning question.
That was pretty much the first question I asked my pediatricians. Okay, I need a referral now. How are his hips? Kind of like a crazy person.
She wanted him checked for signs of hip dysplasia. Tobin was more likely to develop the condition because Kelsey had it as well. But it wasn't diagnosed until she was 21, and she needed 2 surgeries to alleviate the pain.
I just knew that the earlier that if they had it, it was detected, the better the long-term outcome was for them.
Hip dysplasia is the abnormal formation of the hip joint. It can be genetic, but doctors at Texas Scottish Rite warn poor swaddling is causing hip dysplasia in more and more infants with no family history.
It's mind-boggling that something as simple as a swaddle can cause kind of a lifelong disability or hardship for these kids.
Very commonly, the physician who's doing the physical exam can actually push the ball in and out of the socket and feel the hip to be loose.
Dr. David Podeswa says hip dysplasia can develop any time during early childhood. When swaddling, a baby's legs should be in a frog-like position and should have enough room to move around.
The technique of swaddling is important so as not to swaddle the baby with the hips in extension and in adduction, meaning that they're not next to each other.
He says it's important to get treatment right away, like Tobin, who will wear this harness for the next few months.
Tobin was born with it most likely because of my family history, but a lot of kids develop it as a result of, improper swaddling. So if people can just be more educated on how to properly swaddle, they also won't have to go through what I went through.
If you're a baby's pediatrician, here's a click or snapping sensation when examining your baby's hips. The doctor will typically send you to a specialist.